understand and consent that the following information will be gathered and utilized for educational purposes by Indiana Wesleyan students. I allow this information gathering and physical assessment to be videotaped and posted on YouTube for access by faculty at Indiana Wesleyan University. The video will be deleted by the student as soon as it has been reviewed and graded. I further acknowledge that this is for educational purposes only and the information is not meant to be diagnostic. Therefore, Indiana Wesleyan University and the faculty and staff as well as students are not considered liable.
Hello, Mrs. Cusmano. My name is Tara, and I'm going to be your nurse today. And we're going to do a full head-to-toe assessment, and starting with your vital signs. But first, I want to be sure that you understand that if I do anything that causes you some discomfort or you're uncomfortable with, then let me know, okay?
Okay.
First, we're going to start off by doing your vital signs. That includes your blood pressure, your pulse, your temperature, your pulse ox, and me just taking your pulse. I think I said that. What does your blood pressure normally run?
120/80.
Very good. I got 104/62. I'm pretty calm today. There we go. Now we're just going to check your pulse ox here. See how well you're perfusing oxygen through your system. Good, you're at 98%. Now we're just going to check your temperature under your tongue. Very good. You're at 98.6. That's perfect. Now I'm just going to take your pulse, all right? Your pulse is about 78. Now what I'm going to do is we're going to just, like I said, check you out head to toe. And again, if I do anything that makes you uncomfortable or hurts, let me know, okay? So I'm going to start with your head here. And what I'm feeling for is just to make sure your head feels well-rounded, which it does. Make sure there's no soft spots or that you have any lumps or protrusions coming from your head, which you don't. Very good. Now I'm going to just check your temporal pulses here. And feel the elasticity of your temporal lobes here. And do you have any discomfort up here on your forehead?
No.
Okay. What about here across your cheekbones here? Any discomfort? Right now I'm going to feel behind your ears, which is called the preauricle. I'm just feeling for any swollen lymph nodes. And I'm not feeling any nodules and no swelling. And now I'm going to feel in the front, which is called the preauricle. And again, I'm feeling your lymph nodes to see if there's any swelling or any protrusions. Very good. I'm not feeling anything. You're having any discomfort in those areas?
No.
Okay, good. All right. Now what we're going to do is just check some cranial nerves and check your vision. So what I'd like you to do is just stare right here at my nose. And now just follow my finger with your eyes only, not your head. Okay? Very good. And back to the center and to your left. Very good. And then follow it as close as you can in the center. Very good. Alrighty. Another test I'm going to do is just to check your peripheral vision. So as I come forward with my fingers, I want you to tell me when you can start to see my fingers move.
Now.
Very good. Alright. Now I'm going to just check the health of your eyes. I'm going to lower your lids just to take a look at your sclera, which is nice and white and No redness, no drainage. That's good. Looks nice and moist. And now with my ophthalmoscope or my otoscope with the light, I just want you to look right here at the bridge of my nose, and I'm just going to check to see how your pupil reacts to the light. Okay? Very good. Your pupils are round and equal, and they are very reactive to light. So that's great. Oops. Actually, we're gonna now from here we'll move downward. I'm just gonna take a look up your nose, just to make sure your septum is midline, which it is, and you don't have any drainage, and your mucous membranes look nice and pink. So now I'm gonna just take a peek in your ears here. I'm checking your ear canal and your tympanic membrane, just to make sure your canal's clear and your tympanic membrane is kind of pearly white. And both sides look free from any drainage, and mucous or tympanic membrane looks good and intact. As we're moving down, I'm going to check your tonsils in your throat and inside your mouth. So if you would open your mouth real wide for me and say ah. Looks like your uvula moves appropriately. You still have your tonsils, which look good. They are pink and your mucous membranes are moist. I'm not seeing any lesions in there. And your tonsils aren't swollen. They're not hurting you at all.
No.
Okay, great. One more time, open real wide. You've got all your own teeth. It looks like a little bit of repair, but they look like they're in good shape. And stick your tongue out nice and far for me. Very good. Move it side to side. Very good. And lift your tongue up one more time so I can see underneath. And your frenulum is midline, which is great. Not seeing you don't have any unusual lesions or anything in your mouth that you're noticing. Great. Now we're going to check a couple more cranial nerves. So what I'd like you to do is squint your eyes and open your eyes real wide and show me your teeth. Very good. And blow your cheeks out. Very good. All right. And I'm looking at your lips, and do you have trouble with dry lips at all? Because they're looking nice and pink and moist and free from any lesions. I'm not seeing anything there. Now we're going to just check the strength of your neck, and also it's also another cranial nerve that we're checking. So what I want you to do is to push against my hand. Okay, so if I'm giving you resistance here, push, very good, and on the same side, do the same, very good. Now what I'd like you to do is just rotate, bring your chin down and rotate your head in full circles. Very good. I'm not feeling any crepitus and no unusual difficulty with that movement, right?
No.
Very good. Now I'm going to check some lymph nodes down further and check your trachea and your thyroid gland here. Your tonsils don't feel swollen, which is good. I'm not feeling any unusual nodules on your thyroid. And swallow for me. Good. And your trachea feels like it's midline, which is great. And now I'm going to feel for those lymph nodes in the back of your neck. And in your clavicular triangle here. Any pain, any discomfort here?
No.
Good. Very good. And I'm going to check the back of your neck and down your spine. And I'm not noticing any protrusions along your spinal column. Do you have any discomfort, any pain in those areas?
No.
Very good. Now I'm going to check some range of motion in your arms, okay? So I'm going to have you bring your arms straight up and straight down and bring it in the front and bring it in back of you. Stretch it back there. Any pain, any discomfort there?
No.
Okay, good. I'm going to check your elbow here, just make sure. Very good. And your wrist. Your skin looks great. Your turgor is good. Your arms are nice and warm and your skin's pink. That's good. And bring it down. Palms look nice and pink. And your capillary refill is good. That's how fast your blood is circulating. Now I'm going to check a couple pulses here. This is your ulnar pulse. Strong and present. Your radial pulse, very strong and present. And your brachial pulse. Which is also present. Okay, I'm going going to get my reflex hammer. I'll be right back. So now what I'm going to do is just check some reflexes in your wrist and in your arm, okay? So just try and relax your arm right down. There you go. Very good. Very good. Alrighty. We're going to do the same thing on the other side. So bring your arm out for me and up over your head and bring it down in the front and behind. Any pain, any discomfort with that?
No.
Okay, good. And we'll check your elbows here. Very good. And a circular motion. Very good. And your wrists. And as I'm observing your joints here, I'm not noticing any redness or swelling in any of your joints or any warmth. And the skin on this side looks nice and pink, and your palms are nice and pink. And your capillary refill is also very good. So I'm going to check the same pulses on this side that I checked on the other side. Very good. And your brachial pulse. Very good. Sounds very good. And I'm going to come back on the other side there. Oops. Actually, let's check your reflexes here on this side. Just relax your arm right in my hand. There you go. Very good. Very good. Save that. Now what I'm going to do is I'm going to listen to your heart sounds and also listen to a couple more pulses that you have in your body. One of the pulses that you have is called a carotid pulse, and that's on both sides of your neck. And I'm not hearing any unusual thrills or what we call bruit, which would tell me that your blood's moving through harder than it needs to, which is good. I'm just going to check your heart here. Okay. Very good. You have a nice sinus rhythm. And I'm not noticing any murmurs or abnormal beats, which is good. Very good. Now I'm going to take a listen to your lung sounds, and we're going to start in the back. What I'd like you to do is take a nice deep breath for me. Very good. And again. And do you smoke?
No.
Have you ever smoked?
No.
Okay. Nice deep breath. And your lungs sound clear, both sides. Nice easy respirations. I'm going to take a listen in front. Just breathe normal, okay? Okay, and one more sound right here underneath. Take a nice deep breath. Very good. So your lungs and your heart sound really good. Nice and easy respirations, not labored, and your heart sounds real good. Nice even rhythm. So now what we're going to do is we're going to take a listen to your belly and then do your lower half of your body. So I'm going to ask you, if you could, to lie back for me. And are your legs comfortable?
Yes.
Okay, let me just grab another piece of equipment here. All right. Do you have any issues with your belly at all?
No, I have a little bit of reflux is all.
Okay, and what do you take for that?
Protonics.
Okay, sounds good. I'm going to start off just by listening to your belly, okay? And you have very active bowel sounds. which is good. You have regular bowel movements. Okay, good. I'm just going to take a listen to your aortic pulse here. I'm going to feel for your belly button. Very good. Not noticing any swishing or what we call a bruit or a thrill. Now I'm going to listen for your femoral artery, or I'm sorry, your urethral arteries. Very good. Now if this was a full assessment, I would also be assessing her femoral arteries. Now what I'm going to do is just take a little bit of tapping on your belly. Alright, I'm just going to take a feel just to see if I can locate where your liver is. Check your liver span is about right here. No pain or tenderness in your belly at all?
No.
You've got a good just general sound timpani throughout. Very good. Alright, now what I'm going to do is I'm going to press on your left side. I'm going to press kind of deep and then I'm going to let up. And you let me know if you feel any discomfort anywhere, okay? Alright. Get your hip bones right there. So I'm going to press kind of deep. You have any discomfort anywhere?
No.
Okay, great. Alrighty, I'm going to rest your leg right in my arm. And what I want you to do is I'm going to put some pressure pushing down while you push your leg up, okay?
Okay.
Alright, so I'm going to push, now you pull up. Any discomfort anywhere?
No.
Okay. Now I'm going to check your, this is called an obturator test, which tells me a little bit about what's going on with your appendix, okay? So I'm going to lift your leg and just rest it right here in my arm, okay? Just relax it right down. There we go. And I'm going to just bring your knee up. Do you have any discomfort anywhere in your belly?
No.
Nothing. Okay, good. That means your appendix is just doing great. All right, and also that shows me that your hip joint is working very well. You're not having any discomfort there either?
No.
All right, I'm just going to check your knees out here. And feel for your popliteal pulse. Very good. Do you have any swelling in your knees? Do your knees bother you at all?
No.
I'm not noticing any redness or warmth or swelling in your knees. Anything in your calves at all?
No.
Okay. I'm going to bring your foot up just a little bit. We're just going to check the range of motion of your ankle. Very good. And I'm just going to check your pulses here. And those are present there. And present there. Okay. You kind of have a little bit sluggish of a reflex there. And just try and relax your leg a little. I'm just going to check your reflexes on your knee. Maybe a little hard with you. Just rest your leg right in my arm. There we go. Okay. Now we're going to do the same thing on the other side. I'm going to raise your leg up. We're just going to move it. Just check for range of motion. You tell me if you have any discomfort anywhere. Any discomfort at all?
No.
Great. I'm going to check your knee for range of motion. And while I've got your foot here, I'm just check your ankle. Very good. I'm not noticing any swollen joints and no redness, no warmth. And check for your popliteal pulse here. Very good. And we're going to check your reflexes on this side. So just rest your leg right in my arm. Just rest it right down. There we go. Okay, very good. All right. I'm going to check your pulses in your foot. You can just rest it right down. And if that's present. if you would hold your hands right straight out in front of you with your eyes closed. Alright, now bring your arms out to the sides. And with your eyes closed, bring your index finger to your nose on one side and then on the other side. So close your eyes. Very good. On the other side. Awesome. That's great. Now we're just going to check some things. I want to see how your gait is, so we're going to just have you walk just a short distance, okay? So go ahead and hop down for me. Now if you would just walk to the desk and swing your arms from side to side. Just a nice steady walk. Okay. And come on back. Very good. Alright, now you're going to go back to the desk, but what I'd like you to do is do a heel to toe and try and keep in a straight line. Alright, and as you come back, can you walk towards me on your tiptoes? Alright. And as you walk back that way, walk back on your heels, just your heels. Okay, and you're going to turn around and come back this way. And I think that concludes our assessment. You're very healthy, Mrs. Kuzmano. Thank you very much.
Thank you.
Alright.